As both Washington and Idaho are working to vaccinate as many people as possible against COVID-19, many people have asked how many doses have actually been administered.
So this has also led to some questions about differences between the two states and between the Idaho Panhandle and the Spokane-County. Now, Ian Smay of our KREM 2 vaccine team is joining us now from the newsroom just to break down the data we've got so far. Hi, Ian.
Yeah, we are now about 2 months past the start of the vaccine process in both Washington and Idaho. But how do the states match up when it comes to actually getting shots in arms? And what about Spokane County and the Panhandle? Well, as it turns out, the data shows things are staying pretty even.
Let's start by looking at how the vaccine push has gone for both states. According to data from the Washington Department of Health and the Idaho Department of Health and Welfare, Washington started out with about 50,000 more doses starting on December 27th. And as the numbers show, that gap seems to have widened as the weeks have went by. According to the latest numbers from the Centers for Disease Control and Prevention, Washington is sitting with more than 1 million more doses administered as of today. But that doesn't tell the whole story. Washington has a lot more people than Idaho. So let's look at doses per 100,000 people. When we look at the data this way, the gap tightens. Washington has only administered less than 1,000 more doses per 100,000 people. Washington is sitting at 19,701 doses per 100,000 people, with Idaho at 18,721 per 100,000. But what about the two main health districts in our area? When we look at vaccine doses as a raw number, the gap between the two states seems to reappear. Spokane County, as of February 10th, has administered 74,669 doses. Over in the Panhandle Health District, that number sits at 25,841 as of today. We should note again, the latest data available for Spokane County is from the 10th. But again, this doesn't tell the whole story. According to a 2019 U.S. Census estimate, Spokane County had 522,789 residents, while the 5 counties that make up the Panhandle Health District only have 245,861. That gap seemingly disappears if we again look at the data on a per capita basis. Spokane County has given 1,429 doses per 10,000 people as of February 10th, while as of today, the 5 counties in the Panhandle Health District have given 1,051 doses per 10,000 people.
Now, of course, there are more differences between the two states, as well as Spokane and North Idaho. For one, Spokane has that mass vaccination site to bolster its clinics, while North Idaho only has smaller vaccine clinics. Also, the numbers we looked at are for doses overall and don't represent people who have received both doses versus just one. Mark, Whitney?